If I need to go see a patient, we used to have the problem and play where's the chart, like where's Waldo. And now we've got it, I can go see the patient, the billing department can work on it, and somebody else can work on it all at the same time.
When you don't have to search for a chart and you can answer questions right away, there's definitely an increase in productivity.
We've added 2 providers since that time with no additional increase in staff, and we do think that we could add another 2 providers without any additional increase in staffing.
We have 51 providers, and they absolutely love it. They didn't have any percentage of loss in productivity.
I'm much more efficient. I am much better able to keep track of things, and I think I'm probably much better medical care.
We're able to diagnose things quicker. I don't even want to talk about how it affects our liability. It's malpractice-wise, it's a godsend. It just really impacts our practice.
The doctors have also seen the tremendous increase in their productivity.
They love it because they can all be individuals, which everybody knows. You can't make them be one, and as a group, they all have to be individuals. And they're allowed to do that with SRS. The doctor is able to focus on the patient. They're able to move them through, quicker, address their problems. They have everything they need right at their fingertips.
But it's made our physicians more efficient because everything is right there.
That helps them in their ability to diagnose, to a formulated treatment plan.
I'm in better control with just about everybody I take care of.
Patients get much more immediate care.
Our emphasis was not changing our interaction with the patients.
Patients want to come into a nice looking office and they want to know that their physician or their group has, as a dermatology, we pride ourselves on being state of the art. We have these flat screens and everything's a push of a button and we're shooting out scripts, via email or faxing them, and it works beautifully for us.
I really love the RX module and the ability to write a prescription out without having a pharmacist not be able to read it.
I'm a surgeon, so I'm not in the office about 40% of the time. I'm in the operating room. So I take my little tablet with me, I sign on to SRS whether I'm in our surgery center or at the hospital. I have full functionality, I can do all my lab reports, I can call patients at home.
Let's say we have a patient who's in labor and her chart hasn't been forwarded to the hospital yet because she's not 36 weeks along. I can remotely log into our server and see her chart and fax her chart from my bedroom to the hospital so that everybody there can take care of her and knows what her lab work is and has seen her most recent ultrasound, and we can take care of her.
It's just plain and simple. SRS just makes life much easier for us.
We save a lot of time in a lot of different areas, which might be a half hour, 45 minutes a day.
SRS means that I now play golf when I'm done with surgery on Tuesdays.